Hello, and thank you for tuning in for this special live edition of Being Well. I'm your host, Key-Ann Armstrong, and tonight we're talking about a heavy topic that affects several people across the nation. That's teenage depression and suicide. And joining me this evening are Dr. Katie Hecksel with Sarah Bush Lincoln, as well as Dr. David Stoltz with Sarah Bush Lincoln as well. Katie is a child psychiatrist and David is a pediatrician. Thank you so much for joining me this evening.
You're welcome.
So we're talking about teenage depression and suicide this evening, and something that our partners on this program have shared with me is something called an Illinois Youth Survey. And among that survey, there were over 3,000 teenagers in a 7-county region here who were surveyed on what their top concern was. And their top concern among 8th graders was teenage depression and suicide. And so that's why we're talking about this tonight. For those of you who are watching, we do have a crisis hotline number. It's the Regional Behavioral Health Network crisis hotline number. So if you are in an emergency situation at the moment and you're tuning in, please call that number. For all others who are tuning in and have questions about this topic tonight, you can call the number at the bottom of your screen and our panel of guests will answer those questions for you live on air. We're also streaming the program tonight at WEIU.net, so you can tune in anywhere across the nation. And if you're looking for a hotline number anywhere in the nation, you can also call the number at the bottom of your screen. They can direct you to the Regional Behavioral Health Network and they will give you that number as well. So let's talk about teenage depression. Let's talk about what it is. What is teenage depression?
So teenage depression and depression in general is a period of 2 or more weeks in which a person experiences intense sadness, depressed mood, or a loss of interest or pleasure in things they previously enjoyed doing. Along with that, there are typically several symptoms that cause decreased functioning. So a change in sleep and appetite, decreased energy, decreased motivation, struggles with self-esteem, and in the most severe cases, thoughts about wanting to die or kill themselves.
Which is a very sad state to be in.
Definitely.
Is that how you would?
And one of the other things that I often see with this too is an underlying irritability, anger, a foul mood. They have a very short fuse. And many times people say, well, the child's having a bipolar disorder. They make a misdiagnosis because the symptom that they're seeing is that irritability.
So we're talking about depression and suicide. So if a teenager is depressed and they may have some of these different things that are leading toward their depression, when does somebody need to take notice of this is leading in a direction of suicide? How do you know?
Sure. I think the important thing backing up to depression is to note, I get a lot of questions from parents, aren't teenagers supposed to be sullen and hiding in their room all the time and constantly, hiding behind their computers, not wanting to talk to me. And there is some natural progression during the teenage years of wanting to separate from parents and figure out their own identities. So the most important thing as far as trying to figure out, is this depression in my child, is it a distinct difference from how the teenager, the adolescent is typically behaving. So usually a lot of these symptoms are occurring at the same time. It's a sudden change in the severity of it. It's not their typical child. And that's, when people should be concerned that it might be more than just, a typical teenager.
Right. Where do you draw the line of what's a normal behavior, a mood versus concern?
That is a next to impossible question to answer easily. Part of this has to do with a person's just underlying personality, but then, like what Katie said, is when you have this change, and it's rather noticeable. Sometimes adults and kids are very good at hiding depression. There's been a stigma about mental health in our society for decades upon decades, and it's still there.
Yes, it is. Now, speaking of decades upon decades, has depression and suicide been as prevalent as it is today, or are we just hearing about it and talking about it more?
I think It is becoming more prevalent in certain populations. I mean, I think we're in a society that's very fast-paced. There are a lot of teenagers and adolescents who are very heavily programmed in after-school activities. There's a lot of pressure for them to perform in school. Social media has brought a whole different dynamic into things where you can reach large amounts of people with small posts, and that's both for good and bad. I mean, we've seen cyberbullying take an impact on people's mental health, as well as people being able to seek help and support for various things such as depression through the media. I think a lot of the time the increased awareness of what depression is and starting to see a decreased stigma as far as acknowledging depression and people wanting to get help for their children or wanting to get help for themselves has helped people to become more aware of it and to talk about it more.
Yeah, I think that's a big key that we've shared among one another in preparation of this program is knowing how to talk about it. So where do you begin a conversation with your child about, are you depressed? Do you feel depressed? How do you even approach that conversation?
You can do it subtly. Have meals together. Try to have the evening meal. Try to make sure that the child is not isolated back in their rooms. The American Academy of Pediatrics does not recommend television in kids' rooms. It forces them to go out with the rest of the family and watch. Talk.
I think there are, this is both for depression and suicide. There's a lot of concern that talking about it, particularly with suicide, is going to worsen the issue or somehow lead your child to attempt suicide. The reality is, a lot of times when people are suffering with depression or suicidal thoughts, by asking them directly about it in a concerning way, saying, I'm really concerned about you. I've noticed some changes. I kind of wonder, is something going on? Are you feeling like you might be depressed? That often opens a door for them to be able to talk about it. And a lot of times that's what they're wanting to do. I think being really non-judgmental, trying not to find solutions for them, trying to understand what their experience is, how you can be helpful from their perspective. In cases where the depression is very severe and people are having suicidal thoughts, making sure that you're not leaving the child alone and not trying to deal with it alone. So, making sure you're seeking out other support, ideally from mental health practitioners, but in the immediacy, other family members, other friends, people that can help you along this process. I think it's really important when you're dealing with children and teenagers to make sure that you don't promise confidentiality. I think it can be really dangerous to promise that you're not going to tell anyone, because the reality is their life is a lot more important than a secret. And in times where that is the case, a lot of times it happens between friends or between siblings. It's much better to break that trust and still have a live person to help than to keep a promise but not be able to help someone.
Right.
And I think the other thing too is to not have a mentality that this can't happen to your child. So depression crosses all gender, socioeconomic, religious, age barriers, different sexual orientations. There isn't a group in the United States that's not affected by depression or suicide. And that's okay. It's okay to get help.
And suicide is preventable.
It is preventable. There are 4 out of 5 completed suicides in which the person who killed themselves gave clear warning signs beforehand. So that's 80% of people that, if we had been able to recognize the warning signs and intervene, could have potentially prevented that suicide.
Okay, well, let's talk about that. What are some warning signs that we do need to pay attention to?
Sure. So if someone, regardless of whether they're depressed or not, so what we find is that depression is a risk factor in 60% of suicides in teens and adolescents. If you're noticing that people, regardless of whether they have a history of depression or not, start talking about wanting to die, wanting to commit suicide, starting to research ways to kill themselves online. There's a lot of access that children, all people have now via the internet, for better or worse. Getting together the means, so if someone is buying a firearm, if they're stockpiling pills, if they're talking about things being hopeless, not seeing a future, being incredibly agitated. A lot of times people will have an increase in substance use around that time and other ways that they're trying to cope to try to feel better in the immediacy. Talking about being a burden to others, wanting to seek revenge when we talk about people who are being bullied and sometimes commit suicide as a way to kind of get back at bullies. Also people who are preparing to say goodbye. So if someone has been very depressed and all of a sudden they're feeling very calm and happy, they're giving away belongings, they're very different than they've been for several weeks preceding, that can be a really significant warning sign.
Okay. How would you like to answer that question, Dr. Stoltz?
I would hardly have anything to add to that. I think the one thing is they often talk about it, and it should not be dismissed. In my career, I've had a couple of times where parents will come in and said, well, she's talked about killing herself, but we don't believe her. We think she's doing it for attention. And then they'll look to me, why don't you tell her not to do that and set her straight? Oh my goodness. Take a child seriously. Take an adult seriously when they're talking about what Dr. Hecksel has mentioned.
Yeah, and I think too, people look at suicidal people seeking attention as a negative thing. You know, I think if you reframe that as someone who is desperately wanting help and maybe not knowing how to reach out, and taking every suicide attempt seriously for a couple of reasons. There are people we know that have repeated suicide attempts and nearly chronic suicidal ideation. The problem is sometimes the suicide attempt that they want to be a cry for help ends up being successful in the sense that they actually do die from it, even though they may not have intended to do so in the first place. So, you know, that can be a significant risk. But yeah, I mean, taking it seriously, expressing concern, you know, if that's the way that they are framing the suffering they're having, maybe helping them to come up with different ways to explain their pain if they aren't in fact suicidal. But it's much better to pay attention to someone saying they're suicidal and be wrong and see that, you know, maybe there was a big attention component to it than to, you know, downplay it and have it be
turn
someone
out
dying.
Right, yeah. So taking time is a problem these days. It seems like everybody's busy and running, and the kids are in activities and stimulated all over the place. You can't disconnect. Does that attribute at all to any of the teen depression that's going on these days?
It certainly can. Many people require some downtime or time to relax. And you have some high-achieving kids that are in multiple sports, they're in multiple clubs, they never have a chance just to sit and do nothing. Then you also have some kids that, how should I say this, they're in so many things they never see the light of day. They are not able to go out and have fun on their own. Mm-hmm. Their time is consumed, and there's this underlying pressure to succeed at everything they do.
Feeling like they need to be perfect.
Yes.
And so when they're not perfect, then they feel bad about that. And then it can lead into depression and one thing after another. But they've got to be exhausted as well. So how does that play in?
Well, I know they've looked at people who have been sleep deprived, and it's used as a form of torture in some cases. And, you know, we're all impaired if you're sleep deprived enough. And then I think if you add on top of being sleep deprived all of these other stresses, either in families or at school or with multiple extracurriculars, it really eats away at somebody's resilience and ability to cope with even some small stressors where they start to feel really big and difficult to overcome.
Right. If you're just now joining us, I want you to be sure to call the number at the bottom of your screen. It's 1-877-727-9348. We're live in the WEIU TV studio, and I'm talking to Dr. Katie Hecksel, a child psychiatrist with Sarah Bush Lincoln, as well as Dr. David Stoltz, a pediatrician also with Sarah Bush Lincoln. We're talking about teen depression and suicide this evening, and we're taking your calls. We have an operator standing by who will message your question to me. You won't be live on air, so if you're concerned about being known and being and talking on air. We won't let that happen. It's private, it's confidential. You don't have to give your name. We're here to answer your questions. If you're struggling with trying to figure out how to talk to your teen, or if you know someone who is, we're hoping that you'll tune in for this episode right now and give us your questions so we can help you out. So, are teens the only ones that are at risk, or does it start earlier and then when it gets up to the teen years, you're starting to really notice this type of thing? Like, how soon can you really take notice that depression is a problem?
Go ahead.
No, you can see depression or stress, anxiety in preschoolers. So you may have a preschooler whose grandmother has died, and you can tell that they are depressed because grandma's not there. Or they have someone who becomes horribly ill. They don't realize that this person is going to get better, but then when one of their friends or a parent or a grandparent becomes ill, they are distraught. Mm-hmm. And you mentioned earlier, one time it was thought that little kids, grade school kids, were not supposed to have anxiety disorders or depression, and that has been shown not to be true for decades.
Right. So what can you do about that as a parent? Talk to them? Should you seek counseling? Should you take them to the doctor? What's the first step?
I think conversation is the first step, really opening it up. There are a lot of good resources, depending on the child's age, workbooks that focus on depression and sadness, smaller books that talk about feelings, including depression and anxiety. I think, giving children the vocabulary to talk about it is really important. Acknowledging that children, depending on their developmental stage, sometimes communicate a lot better through other means, such as drawing or play. And so trying to, get cues when you're hopefully spending time with them in those arenas. If you are concerned that your child might be depressed, a lot of times the first step is going to a primary care provider or talking to a counseling center. The reality, particularly in this rural area, is that there are limited resources in mental health, and we're seeing that around the country for the most part. And so, going into your primary care doctor and saying, I'm really concerned about my kid, this is what's been going on, or calling a local counseling center and saying, hey, my child is doing this, does it seem like that would be an appropriate, reason to come in and talk to you? And they can be really helpful with other resources if it isn't the appropriate, place.
Okay. Talking about local resources, on the Sarah Bush Lincoln website, there is a cord link that has lots of resources. If anyone's looking for more information, you can visit that website as well. And I want to go back to something that you mentioned just a second ago about when you do go to the doctor, you talk to him and say, or her, and say, these are the things that are going on with my child. I don't think that would be so easy for a parent, because I think a lot of times they would feel guilty, like, what did I do? Have I missed something? What have I done here? And kind of withdraw, but you really need to talk about these things and really express these things. So how can you help parents who are trying to get to that point, to get to the doctor and feel like it's okay to talk?
Sure.
Well, one thing that I often bring up is I suffer from depression myself. And I often tell kids, especially teenagers, if you're happy and giddy all the time, never experiencing any sadness, you're weird. This is the one thing, is that people have emotional ups and downs. Normal people will have depression sometime in their life, and I put normal in quotes because a lot of people would not consider me normal, but it's out there, it's prevalent, and people with depression, suicidal ideation, anxiety disorders do not walk around with it stenciled on their forehead. It's very common.
Right.
I think when you're talking about parents, we all, as parents, feel guilty about things. Our child falls off the playground equipment and we think, what if we had been 2 steps closer? Mm-hmm. I think it's natural for parents to want their kids to be healthy and happy. And when that's not happening, to feel like there should be something that they can do to make that better. So I guess I would encourage parents to take that guilty feeling and activate it, do something about it to try to help your child. This is nothing that you did to your child. There are family factors that can make depression more likely. A lot of times if there's a lot of conflict in the family or some struggles with cohesion or children feeling alienated, they can be more likely to be depressed. But using, that guilt, if that is going on in your family, to try to improve the family unit and to function better as a family is much more effective than taking the guilt and not doing anything with it.
Okay. All right. What about mental illness? How does that play into depression and or suicide? Is it hereditary? What can you tell me about mental illness and how it plays into the topics we're discussing?
I often refer to it as a perfect storm. So there are some genetic components to most mental illnesses, but it's not perfect. It's not like the diseases where, a mom has 50% likelihood of passing it on. You're talking about very small genes. So while you might have a slightly increased risk for depression if you have an immediate family member who suffers from it, it's not one-to-one. It's not 100% guaranteed. So usually it's someone who has a predisposed biological risk, genetic risk, who then is under a lot of different stress or is experiencing different hormonal changes around adolescence, where the depression first shows up. So it's often multifactorial.
Okay.
And every once in a while you come across the resilient child that you would think they should have depression. And they just go through life determined. And of course, these are the people that you read about in Reader's Digest. They're held up as this icon you're supposed to emulate, but most of us couldn't do that. Or I know I couldn't.
Right. What are some of the treatment options for teens who are suffering from depression?
So they've looked at people with mild and moderate depression, and they've found pretty similar rates of effectiveness between medication, counseling, and a combination of them. For severe depression, so we're talking about people where their functioning is significantly impaired because of the depression, or they're at imminent risk for suicide. Those people, if it's not so severe that they're immediately hospitalized, do best with a combination of medicine plus therapy, psychotherapy, or counseling.
Okay. And when you say therapy or counseling, are they the same thing? Because, there's all these different words that people use,
Sure.
And then there's psychiatrists such as yourself, psychologists, so how do parents know who to seek out first?
Sure. As a psychiatrist, I went to medical school and completed a residency and then a fellowship, so 5 years after medical school training. So I primarily manage diagnoses, coordinating care with therapists or any kind of testing that needs to be done, and managing medications or other healthcare type things that are impacting someone's mood. Psychiatrists can do counseling or psychotherapy a lot of times in areas such as this, where I'm the only one for several counties. I rely on counselors to do a lot of the counseling. So counseling and psychotherapy, when I'm talking about it, I'm using it interchangeably. So
Okay.
They're generally in this area masters or doctoral level trained individuals who meet with children, with families, with adults, and talk. It's typically a 1 hour session, often for a period of 6 months, give or take, where they're focusing on ways to deal with the mood, how to cope with the things that people are experiencing that are contributing to the depressed mood, how to prevent relapses if they are feeling better.
Okay.
So just improving resilience and coping.
All right. Now, a teen would need to see a pediatrician before they were referred to you, correct?
In our system, yes.
Okay. All right. So, Dr. Stoltz, if parents brought their teen to you and told you what was going on, how would walk a parent through what would take place?
Well, one of the things is I would do a history, and part of that is, for example, I copied off teen depression, and it lists the things I would need to ask about. Since I don't do this every day like Katie does, I would go down the list, see if they met the criteria. I would discuss the treatment options. You have some kids that have depression and they do not want to go to a counselor. But I usually push counseling because I will say that it is as effective as medication, and often the combination of counseling and medication works better. But you go over the treatment options, whether we can refer the person to a counselor at Sarah Bush Lincoln or through the county health department. Then I will go over the medications and point out that many of the medications are very similar. And what we do, or the way I start, is start out with one of the medications from the SSRI class, selective serotonin reuptake inhibitors, and try that. Go up on the dose, see if it's effective. If it doesn't work, I may try another. If things get worse or there's no improvement, I refer to a wonderful child psychiatrist.
Okay. We do have a call from Matt Toon, and either of you can answer this, but it may be geared more to you with what you were just talking about, but feel free to chime in. In your opinion, when is the right time to introduce medication for a teen who is depressed? And when they begin taking that medication, will they take it forever?
When is the right time depends on how the teen is feeling. If they are responding well to counseling, we don't need to consider it. If they refuse counseling, then we would go with the medication. If they're in counseling, seem to be getting worse, or if it's not that effective, we would start.
Okay.
Then when it comes to the length of the medication, sometimes it may be for 3 to 6 months, and then it depends on how they are doing. A person does not need to be on an antidepressant for the rest of their life.
Okay. Now, we talked about this in preparation for this program, about people are concerned about taking some sort of mind-altering drugs and things like that. I want you to talk about what you told me about that.
Okay. Really quick before we do that, as far as people coming into my office, my goal in treatment is to have people on as few medications as possible and on the lowest effective dose possible. I think a lot of times people think that psychiatrists and physicians in general just want to throw a lot of medication at people, and that's certainly not the case with me. I often tell parents that I like to keep patients on a medication if it is effective for 6 months. So 6 months of being depression-free on the medicine, and then to try to go off it. It tends to work better if it's during a lower stress time, such as the summer, than final exam week. But we know that children and adolescents' brains are changing so fast, and they're learning coping skills, every day sometimes. So I never want someone to be on a medicine that doesn't need it anymore. We know that once someone has had one episode of major depression, they're a lot more likely to have subsequent episodes, but it's not 100%. So, if someone goes off an antidepressant after 6 months and they feel terrible and want to go back on, that's fine. I'm not going to force people every 6 months to go off it, but I want them to know that they still need it and aren't just blindly taking a medication.
Okay.
As far as the SSRIs that Dr. Stoltz talked about, people are often very concerned that psychotropic medications are going to change personality. If someone takes a psychotropic medication and it makes them feel like a zombie, I get that comment a lot, or concern a lot, that's not an effective medication or dose for you. I don't know many psychiatrists where creating zombies is their goal in practice. The antidepressants, there sometimes is a side effect of emotional blunting or feeling kind of blah. I tell people that if they start a medicine and it makes them feel worse instead of better, that it's not a good medicine. So to talk to me, but also to know that it can take several weeks for these medicines to kick in, which is rough because usually by the time they get to me, they're struggling a lot and they want something to help their pain quickly. And we don't have that. The SSRIs basically allow a substance, serotonin, to stay between two nerve cells for a little bit longer before the cleanup crew comes and takes away that serotonin. So it's not, it's not doing a huge thing to your brain. It's just, it's kind of assuming that your brain is somewhat sluggish when you're depressed and you need that extra time to allow your brain cells to take up the substance they need and that's a substance that makes you feel happy and calm.
Okay. All right. I wanted to ask, is depression curable or is it treatable?
I'll let you answer that one.
Okay, excellent. Depression is typically a chronic illness with acute exacerbation. So something that people will struggle with throughout their lives. They might go for years without needing medication, feeling very well, and then, someone may die, or they may have a breakup, or there may be a transition in life, going to college, for example, where they struggle with another bout of depression. There are rare instances where someone will have one episode of depression, it's treated, and they never experience it again, but that's certainly the exception.
Okay. All right. We were working with Sarah Bush Lincoln to put this program together in partnership with them, and there was an article with a local principal at Mattoon Middle School, and he talked about social media, and we mentioned this early on in the program, but how social media is playing a big part in teenagers' lives, as it is in anybody's lives these days, and for the immediate gratification and the relationships and the friendships and the connection. But then there's also the other side, along with some of the social media, where we're seeing some of the outlets for some of the suicides that are happening these days too. So let's talk about social media a little bit.
I think one statistic I saw recently, 97% of adolescents and teenagers use the internet, which I guess I was kind of surprised it wasn't 100, but only 16 regularly talk to their parents about what they're doing on the internet. So it's fairly scary. I think, you're wanting to give your children more autonomy and trust that they're looking at healthy sites and interacting with healthy people, but that's not always the case. And what we've seen is that there are a lot of good online resources for mental health. So depression support groups, if you live in an area where there aren't local ones, support groups for parents who have kids with depression, where people can feel like they're not alone. And I think that's a very big positive. Socially, it's a positive. I think a lot of people communicate via Facebook and text messaging, and so it's a way for people to stay in touch. The flip side is that, when someone is a cyberbully, so when someone is bullying someone via some sort of electronic media, so whether it's a text message or a snap chat, you can reach a lot of people with that bullying immediately, whether it's, photos or comments, and it can be quite devastating for people. They found that females are a lot more likely to be bullied, cyberbullied, and also bullied in person. So when people are getting bullied online, they're finding that they are also often being bullied in the schools.
Okay. What would you like to say about social media, Dr. Stoltz?
Parents need to parent, and at times you may have to put limits on it. We mentioned earlier that sleep deprivation has been linked to depression. Well, it may come to the point where at 9 or 10 o'clock, your teenager does not have access to the cell phone. And some teens would become upset. How am I supposed to text through the night if someone texts me? Well, you're supposed to be sleeping through the night. I've had a handful of teens that have gotten themselves off of Facebook because of the bullying. Mm-hmm. They have turned it off themselves without their parents' input. And again, parents have to know what their kids are reading or receiving on the internet.
I think it's easy to get so wrapped up in all the different things that people are doing and posting and feeling like they have the perfect life. They have this, I don't have this, I'm feeling bad about myself. And I see a lot of that, and in preparation for this program as well, one of the people that I talked to from Sarah Bush said, I had a daughter who was Instagramming all the time, and she didn't realize that she was paying more attention to what everybody else was doing. And then once she stepped away from it, she started to feel a little bit better about herself. So not to say that there's anything wrong with it, but if there's things that are bothering you about it, take a break and, try to figure out, hey, maybe that's not so healthy for me.
And one thing or a couple of things that can also help out with mental health is sunshine, getting outside. And if you're locked into a computer screen or a cell phone all the time, you're missing that. And the other thing is exercise. And it does not have to be an organized sport. We're talking of people walking, playing, riding a bike, goofing off, just moving their bodies.
Right. Yeah, we talked about that, about how are you supposed to get a teenager up off the couch or out of their bed if they are depressed and sluggish and not feeling like doing anything. And you mentioned if somebody likes to go shopping, take them shopping. They're up and they're walking and they're doing something active. So look for those things, right?
Sure, yeah. Sometimes you just have to get them to make the first step. As far as the internet goes, they've done a few studies where they've looked at internet use, so hours of usage and depression, and they've found that there's a pretty notable link between the two, which isn't to say everyone who's obsessed with the internet or Facebook is going to be depressed, but there is a connection there.
Okay. We have another call that came in from Arcola, and it's back to medications again. It seems to be the topic that's of concern to people. Do medications have side effects for teens?
Yes. They have side effects. They have the potential for side effects for anyone, and the risk profile, with one exception that I'll get to, is pretty similar whether it's a child or an adult. The most common side effect for the SSRI medications, which is the first line medicine we use for depression and anxiety, most common side effects tend to be gastrointestinal, so nausea, decreased appetite sometimes, and sleep issues, so either making someone tired or having difficulty sleeping at night. What you'll see in the media a lot is the concern about antidepressants making people suicidal. So the FDA in 2004, I believe, came out with the black box warning that basically said that people under the age of 18 were at increased risk for suicidal thoughts or attempts on these medications. They had looked at 100,000 people and found that the risk for the suicidality was 4% in people with the medication and 2% without. What happened after that was a number of primary care providers stopped prescribing the medication kind of cold turkey immediately, and also stopped diagnosing depression at all. And so you had people who were depressed who weren't on medicines anymore and also weren't given alternatives like counseling or other things that might help with depression, medicines that don't have the same black box warning, for example. And so the end result was that you had a number of people who were feeling suicidal and not getting the treatment they needed. So I think the take home really is that depression kills a lot more people. And in this study, the medication, there were no completed suicides. There was no one that killed themselves or died by suicide in the study. But there are lots of people with depression who kill themselves. So you kind of have to weigh the pros and the cons. And when I have a patient come in, and I probably get one or two a year who come in who say they've felt more suicidal with the medicine, we stop it immediately. We try a different medicine and it goes away. So I think as long as you're really open and communicating with patients, it tends to be something that's rare and quickly treated.
Okay, thank you. We have another question from Charleston. What questions should parents not ask a teen who is depressed? Should there be questions that you don't ask, never ask? Dr. Stoltz?
I would say don't ask questions where you try to blame the teen. Why are you doing this? Don't you know that it's embarrassing? You should, or a command, you should be able to get over this by yourself. But if you're concerned, you can ask. You act like you're feeling down in the dumps. You're acting depressed. We have concerns about you. So I think you're better off to ask questions, even though it may be uncomfortable for your teen, and find out if there's really a problem.
So stay away from the shame or the guilt.
I hear this a lot. I think, people are very concerned about saying the right thing. In the end, one of the greatest protective factors for people when it comes to depression or suicide is having an adult that cares, whether that's ideally a family member, but in homes where that's not possible, a teacher, a coach, a neighbor, a leader in their religious community, someone that cares about them and expresses concern. So you can even say, gosh, I don't even know really, I don't know what to ask. I'm not sure, how to support you, but I want to support you. What can I do? What do you need? And if they don't know what they need, kind of brainstorming, maybe we should go to someone else. Maybe we should go to a counselor or a doctor and see if they can help us come up with what we need. But I think the important thing is to express concern less than worrying about saying the right thing.
Okay. Yeah, that was going to be my next question, is what should I do if I suspect my teen is suicidal, and trying to talk and trying to get past that boundary of let's talk about this. But walk me through what a parent should do after opening that conversation up. Then what steps do they take?
Okay. So a patient or a child comes to their parent and says that they're feeling suicidal, or they ask and they say yes. It's important to determine immediacy. So finding out, how long have you been thinking about this? Are you planning it? Have you come up with ways to act this out? Do you feel like you're able to stay safe? If any of those answers are concerning, take them to a local emergency room immediately or call the hotline. Remaining calm, making sure that you're staying with the child, acknowledging the struggle they're having, giving them support without telling them they'll get over it, or trying to solve the issue in the immediacy. You're needing to keep them safe and acknowledging that they're really struggling and that you want them to get through it and be alive.
Okay. Would you like to reply to that question?
No, I would agree with everything she said.
Okay.
I think the big thing is do not blame the individual. And if you are really, really concerned, take them to the emergency room.
Immediate action.
Immediate.
Okay. We have another question from Muhammad. Are kids who are bullied mentally healthy?
It depends on the child. If you have a child that has a predilection for anxiety or depression, it will most likely worsen their mental health. And we mentioned some of the kids who are resilient. I know that I have had patients that if they were bullied, they would stand up, defend themselves, and counterattack, maybe at times too aggressively. But when you have people that do have depression, it often makes things worse.
Mm-hmm. Yeah. So when we talk about risk factors for depression or suicide, basically you're looking at people with those things going on and stating what's more common in them than people who don't have depression or suicidal thoughts. And bullying definitely increases the risk for developing depression or having suicidal thoughts, but it isn't exclusive. So, a lot depends on the support that person has, as well as the ability to stand up, having other social supports that will help them to feel good about themselves.
Okay. Now, we've talked a lot this evening about what can parents do, and we've mentioned teachers, counselors, coaches. What if you're a friend? What should another teenage child do if they have a friend who is talking to them about different things that may lead them to think that they're leaning towards suicide? If there are teenagers out there watching tonight, what can we tell them that they can do to help?
Sure. There are a lot of school programs that are out there that have shown good success rates as far as decreasing suicide. And the main components to them are typically helping people to recognize if they have depression in themselves and teaching teens or adolescents how to interact with friends who might be experiencing that. For people that don't have that in their schools, I think the important thing is to make sure that the person's safe. If the patient or if the person is talking about, wanting to end their life, having ways that they're going to do it, coming up with a date, things like that, you need to not leave them alone and get an adult involved. Don't be the hero. This is life or death, and I would much rather have you get them adult help or help via an emergency room than to find out they died because you were trying to keep their secret safe.
Okay. Dr. Stoltz?
And I would just have to expound on that a little bit. The teen who's trying to be a helper should not take all of the burden upon themselves. You're just, how should I say this? You're a teenager. That should not be your whole responsibility in caring for your friends. So, again, contact a principal, guidance counselor, the other child's parents. Let someone know what's going on.
Yeah, don't keep it a secret. So what can you tell viewers who are watching tonight who may have had somebody commit suicide that was close and dear to them and they didn't recognize the signs or symptoms? What can you tell them to help them?
I think the one thing, just say that you're sorry and it's not their fault. It's a personal loss and they are going to grieve. And again, you need to make sure that there's no blame.
Okay.
I think for people who have lost someone through suicide, there's a big isolation that occurs. People don't know what to say. They tend to kind of but unintentionally alienate those people. There is definitely stigma against suicide. You see very few obituaries that mention suicide in them. I think just, being supportive to that family, asking if they need anything. For parents or for individuals that are feeling guilty that someone killed themselves and feeling like they should have seen the symptoms or should have intervened, a lot of these risk factors and warning signs aren't taught. So if you don't know them, you're not necessarily going to recognize it. Sometimes I think the people closest to the situation are the least likely to recognize it because it's something they're dealing with every day, and it's maybe a small change that's occurring over time. In the end, we all want to help someone who's suicidal not experience the pain they're feeling, because that's the primary motivation for killing themselves, is wanting to be out of the pain they're experiencing. But in the end, they're the ones that take that final step. So they're, as much as we try, in the end, sometimes, we can't stop everyone. So trying to help the people we can, but acknowledging that, you can't be there 24/7 for someone.
Right, okay. So let's go over some of the warning signs, the symptoms that could lead up to this. Again, if some people are just tuning in, missed the first part of the program, let's talk about some of the warning signs of depression to pay attention to, and then also leading into suicide attempts or thinking about suicide when it comes to teenagers. Let's just talk about that again to reiterate.
Part of it is when you go through the diagnostic criteria, and I'm paraphrasing this, feeling of sadness, feeling hopeless and empty, you're feeling depressed and down. Then you have the underlying irritability, and I think this is frequently seen in teens with depression, irritable, annoyed mood, frustration or feelings of anger. Then there's sort of a loss of interest in things. You stop having fun. You stop having pleasure in normal activities. You stop having pleasure in sports. Then you take a beating on self-esteem, a low self-esteem, feeling of worthlessness, and you start to fixate on your mistakes, blowing them out of proportion.
When you're talking about risk factors, so regardless of whether someone's depressed or not, risk factors for suicide. So these are factors that are more likely to be present in someone who has died by suicide than in someone who's not. Most important one is mental illness and substance abuse. That's 90% of people who kill themselves via suicide have a history of one of those. Home environment, so having a lot of conflict in the home, not feeling like they have a lot of support from parents. The community, so people who are exposed to a lot of community violence don't necessarily have a lot of adult mentors, role modeling behavior for them. That can be a risk factor. In the schools, people with learning disorders who are struggling academically and may be more likely to be bullied, as well as the straight A student who's a perfectionist, who may not be able to handle a poor grade well, for example. Getting bullied, feeling like teachers aren't supportive or they can't talk to them, those can all play a role. Once someone has had a suicide attempt, they are enormously more likely to have another attempt. So they're 8 times more likely in the year following that suicide attempt to have another one. And they're also significantly more likely to have an attempt within the first 2 weeks after a psychiatric hospitalization. So it's important to know that if someone has attempted suicide, you're not necessarily out of the woods, and that you really need to keep the dialogue open with them and to make sure they're getting the support that they need.
Okay. Should parents pay attention to their teens' circle of friends that they're around?
Definitely. I'm a father now with 3 grown kids. My wife was the better parent. She kept track of our kids, their circle of friends, and what they were doing. That's just part of being a good parent. You have to know what your child is doing, or if they're engaging in any risky behaviors.
Yeah, I do. I think it's also important to notice that, or to know that 40% of people who attempt suicide have an immediate stressor situationally, and a lot of that happens with friends. So a breakup, a death, a bullying situation, sexual abuse. And so, having an open dialogue with kids about who their friends are, what they're doing with them, making sure they know that they can come to them, even if it's about something that they know their parents don't support, can really help.
So what about parents who knows that one of their child's friends is struggling with these types of issues, that they're depressed, they've either had suicide attempts or something like that? What should the parents think? I really don't want my child friends with this other teenager, because I think that would be something like, oh, I hope my teenager doesn't start thinking like this either. So what would you tell parents in a situation like that? Because the one struggling doesn't need to be alone either.
Right. So there's a lot of concern about suicide being contagious, and there are small pockets where you see a number of young adults that commit suicide in a small geographic area in a short amount of time. That's typically around 2% of suicides. It's not very common, but it definitely is preventable. That's not your typical experience. If a friend is depressed or suicidal, I think as long as your child is setting healthy boundaries where they're not the only person that this individual is talking to, or they don't feel like they're taking on all of their problems without any support from adults or other mental health providers, I think it's good to be a supportive friend, just with limitations.
Okay. Do you have anything to add?
No, it just really depends what the other child is going through and the type of behavior they're being involved in. If they're heavily involved in drug abuse, sexual promiscuity, fast lead-footed driving, you may not want your child around that because of the risk to your own child. Mm-hmm. But as far as they can be supportive to a certain extent.
Okay. So there is help out there. You just need to talk about it. You need to seek it out. Don't keep it a secret. The most important thing to remember, I think, from what we've talked about tonight, is that suicide is preventable and people just need to act on it. So would you like to have any last minute comments on what we've talked about tonight? Have we missed anything that we need to get out to our viewers?
I think for parents, don't be afraid to set limits. Make sure that your child is getting enough sleep. Make sure that they are having some downtime and they are not in too many clubs or too many activities. Make sure that you keep lines of communication open.
Okay. Would you like closing comments?
Sure. Depression is a lot more common than anyone acknowledges. It's a health issue just like asthma and headaches and diabetes. I think it's important to get through the stigma of it and to recognize that it's something that needs to be treated, that it's very treatable, that suicidal ideation, your job is not to figure out whether the person means it or not. Your job is to help them to get help. And there is a lot of help out there. So I would encourage families who are concerned to contact local mental health centers to get additional resources, for anyone to call the hotline if they're feeling concerned that someone might not be safe. But mental health issues are definitely treatable, and there are lots of people, physicians, as Dr. Stoltz mentioned, lawyers, children, adults, who lead very happy and fulfilling lives despite having depression.
Okay. Well, thank you both for being on the program this evening. We've had Dr. Katie Hecksel with Sarah Bush Lincoln. She's a child psychiatrist, as well as Dr. David Stoltz, a pediatrician with Sarah Bush Lincoln as well. We want to thank Sarah Bush Lincoln and all the staff and colleagues out there who have helped align this program and promote this program. We hope that if you have tuned in this evening, we have answered your questions. This program will re-air. You can tune in to WEIU.net for more re-airings and when this is going to be a part of the Being Well season as well. It will also be on our YouTube channel. And we thank you for watching tonight, and we hope that we have helped. Thank you for tuning in.